come now. Now, where does the child go when he either has the diarrhea or the vomiting or the fever? To the office? Stay away from those people, okay? They're really contagious. I hope none of you work in the office, though, okay? I didn't mean anything like that. All right. Most of you will not have children that are diabetics. You yourself or a coworker might be a diabetic, but remember, if children don't eat breakfast, and I think one of the best things the school system ever started was breakfast at school, because then you were assured that at 10 or 10:30 in the morning, these children were not anxious and nervous and jittery and their heart racing because they didn't have any calories in their little bodies, okay? So if you should become aware of that, the child needs something to eat. The adult that you're working with needs something to eat. And one carb will do it, but it feels like you need to eat a truckload of carbs, okay? So something like graham crackers or a little glass of milk or a little peanut butter. And we'll come back to peanut butter because you know it's on the rise for allergens too. If you have anybody that's bleeding, if it's a very small amount of blood, get some. If you have gloves accessible, wear gloves. What's our biggest fear with blood exposure? Hepatitis, TB, AIDS, You could keep going down the road. So put your gloves on, even if it's a small cut. All right, y'all with me? Now, if it's a large cut, most women do this, and I'm gonna have to put the mic down in just a second. Or maybe I can do, I don't know, I'm not very multitask this afternoon, okay? All right, so we've got this wound and it's spurting. You know, little Jimmy stuck little Emily with pencil. And so it's spurting blood now, okay? What do you do for that? You put pressure on it. Well, I don't know, men don't do this, but women do. After about 5 minutes, we've got to peek and look to see if it stopped bleeding. Well, it's not going to stop bleeding. That's a visit to an emergency room, and that has to be sutured, or that vessel sewn up so it'll quit bleeding, okay? So if you have something that's spurting, no, that's an artery, and the pressure from the heart beating is actually going to keep it spurting, okay? I've seen that happen before, and that's not so much fun. Broken bones, strains and sprains, you can't tell the difference unless you have x-ray vision. But you know, if the arm or the leg or the finger is cattywampus, do y'all know what that means? Okay, cattywampus, then, you know, it's crooked, not like it's supposed to be, then that's broken, right? Okay, so think in terms, unless you can do magic, you know, some people can do magic with their fingers, but think about the child. If it's a finger, that's not a 911 call. Mama can come get the child. But if it's a broken arm and more so a broken leg, then be sure that 911 is called promptly and the child is covered, kept still, quiet if possible. Now he's going to be screaming his head off, but try to keep him calm. Do not give him any medicine. If it's hot outside, then try to shade him or put some cool cloths on him and let the ambulance pick him up and take him off. No longer do we recommend to daycares and to schools that you splint the legs together and all that kind of stuff, okay? So just know that that 911 call needs to be made as quickly as possible. Now, sprains, strains, and fractures all swell, they all hurt. Some will turn red, some hurt on the positioning. So keep in mind that you do not have that x-ray vision that you might need. So just do the best thing you can do, and that's called 911 if it happens. Seizures, how many of you have ever seen a seizure? Are they not the scariest thing in the world? When it's your own, was it your own child or a child at school? I've seen a lot of seizures in the hospital, but until I saw my child have one, I really didn't know what a seizure was. And you know, back then they told us to put a tongue blade or a spoon in their mouth, and you don't do that anymore. In fact, one of the I guess biggest lawsuits was, and it was up north, and I want to say it was Minnesota, but that might be wrong, but up north. It happened in a school, and the child had a seizure, and this is probably 25 years ago, but the teacher put a ruler, wooden ruler, the child's mouth. And as the child gritted down and clenched, the splinters from the wooden ruler actually were ingested. And he had severe esophageal tears. And so, I mean, this was like $1 million or so. I don't know what that would go for now, but about $1 million. So, you know, a lot of thought has to go into this. So if you hear somebody older saying, well, put something in their mouth, you know that's wrong. Y'all with me? Okay. What happens is the child may start to have a seizure, and it can be an all-body seizure. There are lots of seizures, though, so I'll come back to some of that in a minute. But if it's an all-body seizure, they generally will tremble and fall to the floor, and their whole body is trembling or shaking. Their head will bump, so put something under their head to protect the head from whatever surface they're on. And then when the seizure's over and done with, turn them on their side so the saliva or the spit can drain out. It might be bloody from them biting inside their mouth or their tongue. Let all that drain out. Dim the lights. Reduce the noise if you can. The thing that happens that's the most embarrassing is not the seizure, it's the fact that sometimes they'll wet their pants. So be sure and put your body, or position your body, so that if the child does have wet pants, then the other children don't see it. And if there's any way you can get all the other children out of the room, if you can move them, because if they've never seen a seizure, they're going to be like stone standing there, you know. So you have to kind of usher them out or pick them up, tote them out, you know. But let the child wake up on his own. Now, if the child wakes up, do your children still take naps? Yes. Have you seen a sleep seizure yet? About 20 minutes into the nap, the child starts to kind of jerking and drawing, and generally it's having what they call a sleep seizure. And so they sometimes will stand up and start to walk. So you really have to protect them from injury if that should happen. Some children are on medicine, some aren't. Some have been on medicine for a while and been back to the doctor for reevaluation, and they've gained 20 pounds, so the medicine doesn't work anymore. Okay? So just watch your children and know which children have problems with seizures. And what causes a seizure? It can be illness, it can be fever, it can be strobe lights, it can be a motion picture that's moving too fast. Transformers. You know, that makes me have a seizure. So just know that it moves really, really fast. So if you're showing that kind of stuff in school, that child needs to be protected from that environment at that particular time. Choking, y'all, everybody knows how to unchoke somebody? Some of you telling a tale. I can tell by the way you're looking at me. Okay, let me show you on my body how we do the Heimlich maneuver. Everybody knows, right? Okay, show me where you put your hands. Some of you don't want to play. Let me see if I do this. So you have to entertain me too. All right, right above your belly button, and somebody's going to have to dig a little bit deeper. Right above your belly button. Your fist, your thumb side in. Put your other hand in support. Okay, now let me show you real quick. I'm going to stand away from the podium so you can actually see me do this. I don't do this but one time because it hurts. I'll show you in slow motion, and I'll show you the fast way to do it. Now, this is in a non-pregnant person, okay? All right. I'm not pregnant. Somebody said I think she is. Okay, so I'll go in and up. I'm pressing toward my backbone and up toward my ribs. You might have to do that more than one time, ladies, okay? All right. Fast motion, it looks like this, and you don't do it unless you walk up to that person and say, and this, I always get tickled at this, you ask them, you say, can you speak? And they go. Then you say, are you choking? And they go. And then you're supposed to say, can I help you? Those of you that live in Brandon, please be putting your arms around me quicker than that. Okay? All right, so this is what it looks like, fast motion.